Good evening, everyone. I'm Samuel. As of late this afternoon, there were nearly 110,000 people on the deceased donor list in the US waiting for a transplant, according to the Organ Procurement and Transplantation Network, which oversees donations in the States. About 20 people die each day without a transplant. These people holding on to hope are family members, friends, and even sometimes ourselves. Organ donation has been a recurring theme in my family. My father and older sister have both donated kidneys as living donors, and two other sisters and I have received 5 kidney transplants between the three of us. It might appear that changing to an opt-out system for organ donation would save lives in the US. However, there are more effective ways to improve the outcomes of those on the donation list. Today, I will discuss the realities of the US deceased donor list to illustrate why some advocate for a system based on presumed consent. I'll explain how living donation provides a better alternative. And finally, I'll touch on an optimistic future. Let's begin with the problem. The United States has a chronic organ shortage. The waiting list keeps growing each year, and according to statistics uploaded this month on organdonor.gov, a person is added to the waiting list every 9 minutes. The number of transplants each year simply cannot keep up, even if you add the yearly deaths to the total of patients removed from the list through transplants each year. As an example of the cruel math involved, the average waiting time for a kidney is between 3 and 5 years. Some would argue that to solve this problem, the US should embrace a presumed consent system to solve the organ shortage by increasing the pool of deceased donors. What is the system we have now, though, and how is presumed consent different? The US currently operates as an opt-in system, meaning that when a person dies, consent through a will, organ registry, or family members is required to donate their organs. In countries with presumed consent systems, opt-out, individuals are automatically registered in the system and have to choose to opt out if they don't want to donate. Presumed consent makes the assumption that most people are in favor of donation, but few would actually go through the steps to register. An opt-out system would increase the potential deceased donor pool to about 98% of the population and wipe out the list, right? Unfortunately, it's not that straightforward. Let's look at some numbers to get a better idea of the reality. According to recent statistics I found on organdonor.gov, only 3 out of 1,000 people die in a way that enables transplantation. A deceased donor can donate up to 8 organs, but according to a report created by Donate Life America that I accessed this week, the average for deceased donors based on the data from 2018 is actually only about 2.75 organs per donor, given the variance in demand for different organs. Given these difficulties involved with procuring deceased donor organs, increasing the pool of donors through the opt-out system would not even under the best of circumstances be enough to transplant more patients than are added to the list in the US. So if presumed consent isn't a good option, what should the US do? The most effective solution would be to increase living donation. Kidneys enable this solution. According to statistics I accessed this week on donatelife.net, a nonprofit focusing on promoting kidney donation and organ donation, 82% of patients on the transplant list are waiting for a kidney. Kidneys are an organ that can be procured from living donors, donating one of their 2. So the potential pool is infinitely larger than the pool of deceased donors could ever be. And deceased donors have to pass away in almost perfect circumstances. As long as the living donor passes the screening and is a good match with the recipient, the transplant can proceed. There are 2 practical ways to increase living donation. The first way is through grassroots efforts on the part of individuals and organizations such as Donate Life. The long, hard work of wearing down DMVs and state legislatures across the country has been very helpful to the culture surrounding organ donation in the US over the past 2 or 3 decades. The federal government and state governments also have a direct role to play through funding. Live donation could be greatly supported through federal backing of transplant infrastructure that functions in a similar way as the United Network for Organ Sharing does for deceased donors. The government should also cover costs for living donors as an incentive. According to the 2019 annual report produced by the United States Renal Data System, Medicare spending by the government for those with kidney disease accounted for $84 billion in 2017. While not everyone with kidney disease is healthy enough to receive a transplant, Medicare does cover kidney disease for all ages, and the government would definitely save money by stimulating living donation. Finally, let's take a brief look towards the future. The future of transplantation seems to be headed towards bioengineering. The most promising and least ethically gray solution is 3D printed organs. Researchers are making progress towards viable replacement organs created using a patient's own cells. According to an article published last year by Dr. Francis Collins, director of the National Institutes of Health, scientists have recently had success creating veins and vein systems, which is one of the most complex obstacles in the way of replacement organs. 3D organs grown with patient cells also have the advantage of sidestepping the huge costs and health risks associated with the necessary immunosuppressants that patients deal with for the rest of their lives currently. While the situation is dire for many, it's not without hope. The effort to change the transplantation system from opt-in to opt-out in the US is not worth it. Thankfully, there are other options. I'm cautiously optimistic as researchers work towards viable 3D printed organs. In the meantime, the waiting list and the suffering of those on it can be greatly reduced through a coordinated effort to encourage living donation. We have the resources and templates, but they do have to be implemented. I want to encourage you all to have uncomfortable conversations. Conversations about medical realities and death. Conversations about your final wishes. These things feel taboo no matter your age, but they're vital to building up our empathy and fully understanding ourselves and those closest to us. Everyone should know donation is possible. Living donation is possible. Thank you. Do you have any questions? Okay. Thank you.